Okay, so this is a story that should be of concern to every single Kenyan. More Kenyans could be dying of cancer than previously thought, says Health Cabinet Secretary James Macharia. Macharia, who today swore in the board of the National Cancer Institute of Kenya, also announced that the government will on Friday adopt a project to dedicate 21 billion shillings to the acquisition of cancer treatment equipment for public hospitals. Sharon Mumanyi has the details.
At their home in Kaaga, Meru County, Mary Wathanu is busy carrying out her usual household chores. But usual is far from what Mary's life has been. 14 years ago, she was diagnosed with leukemia. At the time, the diagnosis itself sounded something like a death sentence to the then Class 8 pupil.
Diagnosis was done here at Meru, but my treatment was further in Nairobi. It was a challenge for us because we didn't have ways to get there. We had to be assisted by friends, family, and also relatives, and also community.
But the family would soon forge ahead, taking Mary for treatment at the MP Shah Hospital in Nairobi, where she underwent a surgery to remove a tumor from her stomach. For 6 months, she stayed at the hospital undergoing chemotherapy and radiotherapy.
Na chemotherapy nayo inakuwa ni ya pesa mingi. Sasa sisi hapo tukaanza kukua kila kitu, tukauza, tukatafuta pesa kwa watu, na ikawa ni challenge kubwa sana.
Mary has lived to tell her story. Statistics indicate that about 22,000 cancer patients in the country do not.
Cancer kills 8 million every year. So whereas the globe, the international institutions, the World Bank, WHO have focused all the resources, attention to West Africa, which is a good thing, they must also reflect on these numbers.
Currently, the country does not keep comprehensive data on cancer deaths and cancer patients due to weaknesses in data collection capacity. Thousands of Kenyans spend billions every year to seek cancer treatment abroad. Majority of cancer patients cannot afford medical care which is actually largely inaccessible due to scarce equipment and oncologists in the country. According to the Cabinet Secretary, the care burden is about to get easier. He says the government is expected to sign a 38 billion shilling deal with multinational organizations this Friday for the supply of critical medical equipment to public health institutions. Macharia says the deal will see all kinds of equipment supplied to 2 hospitals in each of the 47 counties. Out of the 38 billion shillings from the deal, 21 billion will be specifically dedicated to the acquisition of cancer treatment equipment, coming hand in hand with a plan to have expert attention available to all Kenyans.
We have created a very special structure with General Electric, whereby we shall have centers of excellence. The few experts we have, the oncologists we have in the country, will be located in those centers of excellence. But the machines will be located in remote areas in the counties. And the clinical officers will be able to take those images in the counties, and those images electronically transferred or transmitted to the centers of excellence, which will be manned by expert oncologists.
Macharia was speaking at the swearing-in of the board of the National Cancer Institute of Kenya. The Media Owners Association chairman Sam Sholei reiterated the importance of creating public awareness about cancer as a first step of curbing it.
So the media can play a big role, sensitizing the public about the effects of cancer, about the need to go to hospital frequently, and it is recommended every year that people should check themselves to make sure that if there is cancer that has manifested in them, it is detected early so that it can be treated.
Tomorrow the world marks Cancer Day 2015 under the tagline, Not Beyond Us. At a national level, the plan to decentralize facilities and expert care is one that will see strides achieved in the Kenyan fight against cancer. Only patients will still be hoping that soon the cost of this care will not be beyond them. Sharon Momanyi, KTN, Nairobi.